Hello, my name is Greg Hanch. I serve as the Executive Director of NAMI Texas, which is the Texas affiliate of the National Alliance on Mental Illness. I'd like to welcome you to Texas TD Talks. This is NAMI Texas's video series on tardive dyskinesia, which is a movement disorder that causes a range of repetitive muscle movements in the face, neck, arms, and legs. We hope that after watching this video, you feel informed, educated, and inspired. We hope that you will become part of our movement to bring TD out of the shadows. We hope that you will understand that with the right treatment, TD is treatable. I'd like to give you a little bit of background information about NAMI Texas. We are a nonprofit organization founded by volunteers in 1984. We are part of the nation's largest grassroots network dedicated to building better lives for individuals and families affected by mental illness. That is NAMI, the National Alliance on Mental Illness. We have 25 local affiliate organizations throughout Texas. We have over 1,500 members made up primarily of individuals and families affected by mental illness. And our purpose is to improve the quality of life for individuals and families affected by mental illness. Before we go any further, I'd like to give this healthcare disclaimer. The content and treatment resources discussed in this video are intended to educate users on healthcare and medical issues related to tardive dyskinesia. Nothing in the content or treatment resources should be considered or used as a substitute for medical advice, diagnosis, or treatment. Always talk to your healthcare provider for specific guidelines and instruction, including those related to the diagnosis and treatment of tardive dyskinesia. If you are in the United States and are experiencing a medical emergency, please call 911. For a mental health crisis, please call 988. Okay, let's talk about tardive dyskinesia. Tardive dyskinesia, or TD, is a movement disorder that causes a range of repetitive muscle movements in the face, neck, arms, and legs. Although it is sometimes associated with conditions like schizophrenia, TD occurs primarily as a side effect of long-term use of certain medications. It can become a permanent condition even after a person stops taking the medication. Let's talk about what TD looks like. Symptoms of TD can include jerking hand and leg movements, neck twisting, difficulty swallowing, eye blinking and grimacing, lip smacking, and involuntary tongue movements. TD symptoms typically occur after several years of taking antipsychotic medications, although they can emerge within just a few months. TD is also related to prolonged use of medications for nausea and medications that treat neurological disorders, such as Parkinson's disease. TD can look or feel different from day to day. TD affects approximately 600,000 people in the US. It is estimated to affect more than 50,000 Texans. Approximately 70% of people with TD have not yet been diagnosed. How can I manage the risk of TD? If you're asking yourself that question, we have some advice for you. You can help manage the risk by addressing lifestyle factors that increase the potential to develop TD. The risk of developing TD rises with smoking, substance use, and uncontrolled diabetes. Proactively taking care of your health by quitting smoking, avoiding substance use, and managing blood sugar levels can be protective and reduce the risk of symptom onset. You can also ask your provider for routine screening of movement symptoms. Recognizing the symptoms of TD early can help lessen their severity, so we recommend that these screenings should occur every 3 months. We also recommend that you ask your provider to review your current medications and discuss options with you. Although it can still occur, rates of TD appear to be lower with second generation or newer antipsychotic medications. First generation antipsychotic medications have the higher risk profile for TD. Long-term use of antipsychotic medication to treat a chronic mental health condition is usually still necessary, but safely adjusting or changing medication may still be an effective option. Talk with your healthcare provider about your medication options. Just to be clear, we are not saying that you should stop taking your mental health medication just because you're concerned about TD risk or TD symptoms. Do not stop taking your medicines without talking with your healthcare provider. If you have concerns about TD, share them in a frank conversation with your healthcare provider. There are antipsychotic medications with a much lower TD risk profile than others. You have options. Let's talk about the impact that TD can have on a person's life and their daily functioning. TD can cause a person, if not properly managed, to feel uncomfortable in social situations. It can cause people to experience stigma and discrimination. It can cause difficulty securing and keeping employment. It can cause difficulty or frustration with daily activities, such as buttoning a shirt, walking, or drinking liquids. We found a story on NAMI's website by an individual by the name of Bobby Kruger. Bobby talked about their life facing TD. Bobby said, "Antipsychotics saved my life. Since I am diagnosed with schizoaffective disorder, antipsychotics are a big part of my treatment. I'm also, however, got tardive dyskinesia from antipsychotics. Not only do I have an eye twitch and a mouth grimace, TD gave me a twitch that temporarily stopped me from breathing. Consistently throughout the day, I would not be able to breathe because a twitch in my throat would prevent me from doing so. My form of TD is extremely rare and shouldn't prevent anybody from taking antipsychotics." The good news is that TD is treatable. If the symptoms of TD develop, talk with your healthcare provider about it. Your healthcare provider will evaluate your treatment plan and your medication. Your provider may choose to change your medication or add one specifically designed to improve movement symptoms. It's important that you don't abruptly stop taking a medication without talking to your healthcare provider. Each person responds to treatment differently, but effective options have emerged over the past several years that help relieve the symptoms of TD. So yes, TD is treatable. The first level of treatment options include specific movement disorder medications, such as valbenazine and deutetrabenazine. These medications are thought to help by adjusting dopamine reception in areas of the brain responsible for motor control. Even mild TD symptoms should be assessed and treated to lessen these symptoms and prevent further impact on daily function and quality of life. If your provider recommends a medication, but you're concerned about its cost, prescription assistance programs or PAPs may be available. PAPs can sometimes substantially reduce medication costs. It is important to work with your prescriber and have an honest conversation with them about your symptoms, treatment, and any changes you are feeling that are affecting your health. Let's go back to Bobby Kruger's story from the previous slide. Bobby said, "I was diagnosed with TD after I saw my psychiatrist and she noticed my twitching. I had never thought about it being TD. I had always figured it was a nervous twitch. She noticed it in early July, several years ago, and a new medication had just been FDA approved that May. This new medication was the first approved by the FDA to target symptoms of TD. My psychiatrist and I were both excited to try it. I thought I was stuck with this twitch for the rest of my life, but now knowing there was a medication that could help me excited me. My twitch had gotten worse over the year since starting my antipsychotic in November of 2016. It started with just my eye and spread to my mouth, and then eventually my neck and esophagus. I was embarrassed to go out in public. People would stare at me as my eye and neck would violently twitch. I would usually resort to covering my face with my hands to try to conceal the embarrassing motions. The new medication was only available at one pharmacy through mail order, and they were amazing with helping me get my prescription. It is an extremely expensive medication. The company that makes it provided me with a copay card, which means they will pay for my copay until the drug goes generic. I received the new medication a couple days after my 21st birthday, and I was extremely eager to try it. I dealt with some sleepiness and itchiness when first starting. It was about 10 to 14 days before I started that I began to notice a difference. My twitch started to slow down. My neck movements seemed to calm down. My husband noticed that I wasn't choking in my sleep anymore. I didn't experience the full effects until going up to the maximum dose. It has been 4 months now since I started the new medication, and I no longer deal with the esophagus twitch nor the neck twitch. I still deal with the eye twitch and grimace when extremely anxious, but nothing like before. This new treatment has changed my life in ways I never thought it could. I can go in public without fear of being stared at. I can breathe normally. I can feel human again. Antipsychotics changed my life, and I can't imagine my life without them. But now that I have the additional medication, I can't imagine my life without that either. TD is treatable, and the first level of treatment options include these specific movement disorder medications. There are other options as well, second level treatment options, including clonazepam, which is sometimes given as a short-term medication for muscle rigidity. Some people have also found relief from the herbal supplement ginkgo biloba. For symptoms that are less responsive to these treatments, your clinician may prescribe a drug used to treat movement symptoms in Parkinson's disease. There is also some evidence that deep brain stimulation may be effective when other options have not reduced your symptoms. A couple other notes on TD supplementary self-management. We recommend as you have a routine symptom assessment every 3 months with your healthcare provider. We recommend keeping track of your symptoms and letting your provider know about any new ones that you may be experiencing. Talk with your provider about daily functioning and quality of life. Practice self-care, including physical activity. Exercise can help relieve symptoms. Managing diabetes, which is a risk factor. Improving cognitive function, reducing negative symptoms of schizophrenia, and improve response to chemical signals. Exercise is a key strategy in supplementary TD self-management. One of the challenges in improving TD outcomes is that not enough people know about TD in the first place. It is not a household name. TD is often under-recognized, misidentified, and untreated by healthcare providers. So if healthcare providers don't know very much about TD, then the general public likely doesn't know very much about it as well. Individuals who may be experiencing TD symptoms are often confused about and unsure of what's happening to them. They may wonder if it's part of their mental health condition or whether it's something new that they may be experiencing. Healthcare providers don't always connect these dots. Now, a little known law in Texas can have a big impact if we help get the word out and hold providers accountable. This provision in the Texas Administrative Code pertaining to the prescribing of psychoactive medication requires state facilities and local mental health authorities for patients receiving medications known to cause movement disorders to screen the patient quarterly for abnormal involuntary movements using a standardized procedure such as AIMS, document the results, and arrange for any appropriate follow-up with a psychiatrist or neurologist if indicated. Now, I believe Texas is once again ahead of the curve here by just having such a law on the books. But I also believe that compliance with this law could be better. We have to say it loud and say it proud. Quarterly screening for TD symptoms is required for patients receiving certain medications at state facilities and local mental health authorities in Texas. If you're from a state outside of Texas, I suggest you advocate to put a law like this on the book. NAMI Texas has been active on TD awareness throughout 2023 and years before that as well. Last year, we put out our first Texas TD Talks video. You can go back on our YouTube page and find that. We had conversations with several healthcare providers and also a person who is affected by TD. This year, we're putting out a new version of Texas TD Talks. This version of Texas TD Talks is focused on the Texas legislature because the Texas legislature has stepped up to the plate and recognized the importance of TD awareness. And the governor of Texas has done so as well. So we're calling this Texas TD Talks #TexLeg Edition, which is the hashtag for the Texas legislature. Earlier this year in May, we held a TD Awareness Ice Cream Social at the Texas State Capitol. That event was attended by over 50 legislative offices in the Capitol, and we used it as an opportunity to educate legislative staff about the importance of TD awareness and how they can support constituents who may be affected by TD. Also, at our Mental Health Capitol Day rally, which was attended by over 250 people, we brought up TD awareness. That event was held in the first week of May, which is TD Awareness Week across the country. We're furthering the conversation around TD and putting this information in the hands of people who have an opportunity to make a difference in areas across the state of Texas. They can engage with their constituents and provide education about TD and spread the message that TD is treatable. We also have spotlighted Governor Abbott's TD Awareness Week resolution that he put out earlier in the year. You can see that on the left side of the screen. And we appreciate the governor continuing to recognize and acknowledge the importance of TD awareness. Okay, we're going to transition here into a couple clips from our Texas TD Talks Ice Cream Social, and then we will hear a conversation with TD experts. Thank you all.
TD is characterized by uncontrollable, abnormal, and repetitive movements of the face, torso, or other body parts.
70% of people living with TD in the U.S. have not yet been diagnosed.
TD affects around 600,000 people in the country.
Symptoms of TD can vary from person to person.
Raising awareness for TD is not only important for family members and patients, but also the general public so they have a better understanding and feel more comfortable when they experience someone with TD.
Welcome to Texas TD Talks. Texas TD Talks is NAMI Texas's video series dedicated to raising awareness about tardive dyskinesia. I am honored to be here today with two healthcare providers who focus on supporting better outcomes for individuals affected by TD. We have Dr. Rakesh Jain and Dr. Stacy Finkbeiner. I'd like to ask them first, we'll go to Rakesh first and then Stacy, what drew you to working in movement disorders and mental health?
Yeah, terrific to be with you, Greg and Stacy, and hello, everyone. I am a psychiatrist, so you might wonder why in the world would a psychiatrist be interested in anything below the neck, right? We're only supposed to be interested in the person's brain and mind. But the reason why I got drawn into movement disorders is quite simple. My patients who often have psychiatric illnesses also have movement disorders of one kind or another. And to not help them with that would be an abdication of responsibility and duty on my part and my profession's part. Therein lies the main reason, Greg, why I became interested in movement disorders.
Thank you so much for sharing that. It's very powerful. Stacy, how about you?
Yeah, so my path's a little bit different. I'm actually a scientist by training. So I was one of those nerds that worked in the lab. And, you know, for me, it wasn't close to the patients. So I actually started to explore what were some other options for someone with, you know, science background, and farm my way into some of these other options in the pharmaceutical industry where we provide education and do research and talk about science. And so I kind of actually found my way into TD first and then into the broader mental health space. For me, the draw is, there's such a huge need. And to Rakesh's point, sometimes the movement disorders aren't always considered as part of the whole mental health picture, but the huge impact that they play. And so it's such a huge opportunity to be able to focus on education and generating new data to kind of help the individuals that live with TD and mental illness.
Thank you very much. So two sort of different perspectives on this issue and how it affects patients, unique perspectives, and I'm looking forward to learning more about how TD has affected patients that you have provided care to over the years. I'll go to Rakesh. I'd like to hear from you on that, Rakesh. What sort of historical perspective can you offer on how TD has come into play for your patients over the years?
So TD has been around since 1950s, and you might wonder, wow, he's so precise about that. Why since 1950s? Because 1950s is when the first antipsychotics came into being. And since then, I would say several million individuals have been afflicted by this condition we call tardive dyskinesia, which really is, if you will, a side effect of having been on chronic treatment with antipsychotics, be it for schizophrenia, bipolar disorder, major depression, or for any other condition. So at the current time, Greg, I am very sad to report to you and to your NAMI family members, 700 some thousand human beings have tardive dyskinesia, and less than 15% are actually either correctly diagnosed or treated. The numbers are really, really sad. And the main challenge is clinicians tend not to look for it or be aware of it, but I also think I'll put part of the responsibility on the patient and the family members. They often don't report it to the clinician. So it's a team effort. Everybody needs to play a role in improving the numbers from just 15% identification and treatment to greater numbers of people being treated. Because as Stacy said a minute ago, quite eloquently, this is not just a movement disorder. This is a movement disorder that extracts a very heavy price from their lives in the biological realm, which means just doing things with your muscles, walking, talking, cooking, driving, but also what it does to you psychologically. It can devastate your self-esteem, self-confidence, worsen your depression, and of course, social. Many people with tardive dyskinesia I've interacted with have learned the art of hiding at home so that others can see their plight. So for all the reasons that I've said, Greg, it is so important for the NAMI family to be very aware of tardive dyskinesia. And if they suspect something, say something.
So TD can have an enormous impact on a person's life trajectory, especially if the TD is not identified and treated. So 15% or less of people who have TD receive appropriate identification and treatment. What can you tell us a little more about what a person's life might look like if their TD is not identified and treated, and what might a person's life look like if they do receive proper identification and treatment? Dr. Jane first, and then Dr. Ryan.
Okay, sure. I'll get the ball rolling. I have never met someone who has TD ever who isn't impaired by it. By impaired is a big fancy word for saying something bad happened to them because of having tardive dyskinesia. Sometimes patients themselves don't know because they've had it for so long, or their psychiatric illness stops them from fully appreciating how bad things are. But to answer your question quite directly, Greg, tardive dyskinesia appears to be a great thief, and it robs nearly everything people hold dear to them. So what do people hold dear to them? Well, they hold their mental health as very important. NAMI knows that well. And yeah, tardive dyskinesia can make it much more difficult for antidepressants and antipsychotics to work. But the biggest impact, the research Stacy and I have been doing over the last several years, reveals that it's psychological and social burdens that are co-equal partners. So I can't think of one thing that tardive dyskinesia can't rob a person of. And to your point, so why even treat it? What's in it for the patient and the family members? And what's in it is once the movement disorders dissipate and are under better control, people slowly but gently reemerge. They reemerge into being able to do things, Greg, but also feel more confident and feel like they can take on the daily challenges of life.
Well, that is incredible that, treatment is having such a positive impact on people's lives. To go from experiencing extraordinarily negative symptoms and being extremely marginalized by those symptoms to then having full and robust recoveries. I'm looking forward to hearing more from you on sort of what impact TD treatment can have on a person's life and just how beneficial it can be. I wanted to ask Stacy, what is your perspective on the subject of how TD can impact people's lives, and how well we are doing in identifying TD and providing treatment for it?
Yeah, so I think, this question of how TD impacts an individual's life, it's a really important question that until relatively recently, we haven't had many answers to. But it's such a fundamental question, right? To understand how this impacts individuals. So this has been a huge area of focus at Teva, and the work that I've been doing over the last few years to really understand the patient experience and all the different ways in which TD can affect an individual living with TD in their day-to-day lives. As Rakesh mentioned, there's all these different facets of the way that it can affect an individual that we haven't fully, in the past at least, maybe thought about. And it's a really challenging question too, though, because no two individuals with TD are the same. The movements are different. Every individual, their life perspective, what their day-to-day life looks like in general is different. So the way that it impacts them is very different. But it's really important for us to have a clear characterization, description of what that could look like so that clinicians know what questions they should be asking their patients, and patients know what issues they should be bringing up to their clinician to talk about. Because to Rakesh's point, sometimes individuals or families don't know that something is potentially TD, or they don't bring it up for various reasons. And so really needs to just foster better communication from both sides.
The Impact TD scale is an easy-to-use, standardized, and clinician-rated assessment intended to assist healthcare providers in determining the impact of TD on patient daily functioning. Impact TD categorizes TD symptoms into multiple functional domains: social, psychological/psychiatric, physical, and vocational, educational, and recreational. The scale can collect insights from not only patients, but also family members, caregivers, and providers. This can help encourage productive dialogue and provide a more comprehensive understanding of the impact of TD. The Impact TD Scale consensus statement was published online in the Journal of Clinical Psychiatry in November 2022 and is now in print.
So I'm really, proud to be a part of all of this work and to have Dr. Jan as part of it. So I do want to mention, first of all, that we have an Impact TD registry. So this is a large study where we are looking to follow 600 individuals living with TD over the course of 3 years. And the goal of that is to better understand the characteristics of their TD over time and the impact of TD on their quality of life. So this is underway, and we're hoping to have some at least preliminary data to start looking at probably sometime next year. And the idea here, we believe this is going to be the largest study of TD patients to date to really help us understand that perspective. But we've already completed some really interesting studies. One that I think is pretty clever, and I can say that because it wasn't my idea and I wasn't involved, was one where we really wanted to look at the potential stigma that's associated with tardive dyskinesia. And so for this study, we hired actors and they recorded 2 different videos. In one, they had a script that they followed, which described themselves and qualifications for a theoretical job that they might be applying for. And in the first video, it was just the actor going through the script, as they are. And then in the second one, in addition to following that same exact script, they also portrayed facial movements of TD. We then took these videos and we showed them to random people in the general public and asked them to give their responses to some statements. So for example, watch the video and then respond, I like this candidate as a potential employee. And just to generalize the results, what we saw is that people responded less favorably when they watched the video of the actor portraying TD than when individuals saw the video of the actor who was not portraying TD. So this reveals, that there is a real potential stigma, certainly in a professional setting, that can affect people's ability to get or maintain employment or the type of jobs that they might be able to get. And then we did the same kind of thing with 2 separate videos that were more focused on in a dating context. So it was kind of mimicking if someone were presenting a video on a dating app, or if they were trying to introduce themselves to a new potential friend. And the results here were, again, similar, that we did reveal that there was a stigma associated with TD when people are in a dating context. And we did, with friendship, it was actually a little bit less pronounced, which is good, that people are, I guess, are a little bit less judgmental, have less bias when it comes to their friendships. But the point of this work was really to raise the level of awareness of how TD may affect individuals' lives in ways that may not even be obvious at all, because you don't necessarily always know how other people are reacting to you. And with any type of, implicit bias, the first step is overcoming it, is to make sure that people actually know that it exists. And then importantly, a key point of this work was intended to help educate healthcare providers so that they consider these types of factors when they're thinking about how to talk to their patient and manage their TD in order to improve their quality of life. Another study we did in collaboration with Dr. Jan, so I'll let him tell you more about that one.
What Stacy said is just so very impactful, isn't it? It reminds us, no matter what we like to believe, that we don't have biases against people with mental illnesses. NAMI members know there is a bias. There is. There is a bias against people with psychiatric disorders. But just imagine if you have a psychiatric disorder and a movement disorder on top of it. How is the world perceiving you? How are your friends perceiving you? How is your employer perceiving you? How is the bus driver perceiving you? And pretty much Stacy's data shows that there is a negative bias. I think people are kind. It's just that they don't understand TD, and they are often seeing these individuals as scary or to be avoided or not to hire them or whatever. But coming back to what you had asked me, Greg, yes, indeed, we have now published one and pretty close to publishing the other survey, very large, in fact, the world's largest surveys, of looking at individuals who have tardive dyskinesia and asking them how much suffering, how much impact, how much of a negative influence tardive has on your not just functioning, but different elements of functioning. So doing things, so biological, psychological, social, and we also asked their caregivers, people who lived with them. So not necessarily people who did things for them, but people who sort of did things for them, but also were family members or friends. How much does that person's tardive dyskinesia affect you? And hopefully in show notes, you can put a link to the paper. But the upshot of it is we have a lot more work to do than I thought we did before we started doing the research.
In the fall of 2021, research presented at the Psych Congress conference in San Antonio, Texas, looked at TD caregiver burden and TD patient impact. The research methods included literature reviews, interviews, and surveys. The first study, focused on caregiver burden, found that although most caregivers did not consider helping patients with individual tasks burdensome, responses regarding impact on their own activities and psychological well-being reflect a cumulative burden of supporting patients with TD. And the second study focused on caregiver burden and using survey data from both patients and caregivers had several key findings. First, it was found that TD imposes a substantial burden on patients' physical functioning, mental well-being, and social activities, even in patients with self-assessed mild to moderate TD symptoms. Secondly, TD also impacts how patients manage the underlying condition, suggesting that better TD symptom control may reduce patient burden by reducing antipsychotic treatment disruptions and non-adherence. And finally, these results reinforce the need for healthcare providers to assess impact to patients when assessing TD movements. In April of 2023, research published in the Journal of Clinical Psychiatry lent further insight into the impact of TD on patient lives. Using online survey data and interviews, researchers found that TD imposes a substantial burden on patients' physical, psychological, social, and professional lives and impacts management of their underlying condition.
I have to again ask members of NAMI who are listening to us to appreciate this will not happen just by changing the minds of clinicians. I'm working on that. Stacy's working on that. It's going to be very important for mental health organizations like NAMI to take a leadership role in educating about TD, which Greg, you're doing right now, but to take one step further. If you see something, say something. Tardive dyskinesia is often irreversible, meaning you can't just say, let's just wait a month. Let's see what this cough is going to do. It doesn't work that way. If you see something, it's so important to bring it up to your clinician's attention and ask them, do you think what I've got is a movement disorder? Do you think it might even be tardive dyskinesia? Being that direct with your clinician is often necessary. Our data, and I will just offer you a quick conclusion here, is showing people with tardive suffer in every which way we can think of. And people who live with people with tardive dyskinesia also suffer substantially in a lot of different ways.
I really enjoy the fact that you brought up that with tardive dyskinesia, time is of the essence. The earlier we make an intervention, the earlier a person gets access to treatment, the better their outcomes will be in the short run and the long run. So I think it's important to underscore that point, that TD is treatable, and it's better for a person to receive that treatment earlier than it is for them to receive that treatment later. I'd like to ask you if you have any stories of patients that you know who have been impacted by TD, who you think their stories really show the points that we've been making on this call in a personal, sort of qualitative sense. Are there any patient stories you can share?
Sure, quite a few, but I'll perhaps share just one that immediately comes to mind. But I do want to also remind folks that treatment of tardive dyskinesia is actually quite effective for a lot of people. Not for everyone, I wish it was, but we have now FDA approved treatments that are so impressively effective. But yeah, patient stories matter. We human beings resonate with human stories. So I'm thinking of a lady I've been taking care of since she was only 11 years old. And she's now 24 and about to start graduate school. It's an amazing story, but a huge amount of suffering with severe mood disorders. And I had to treat her with an antipsychotic medication, not because she was psychotic, because we sometimes use these medications to help antidepressants work better. Well, in her case, she started having eye blinking. And soon after that, she started having lip twitches. And very problematically for her, she started having tongue movements. These are pretty classic areas, Greg, for tardive dyskinesia to affect you. The first thing we tried to do is to reduce the dose of her medication and to try and stop it. You know what? It didn't work. In fact, it didn't work at all. She got much, much worse with her mood difficulty. And we decided the best thing to do is to offer her treatment with a medication that's FDA approved and to continue her other medications. Now, it wasn't the fact that her lips and her eyes and her tongue were misbehaving, so to speak. It was that because of this, what she was now not able to do. She was an honor student at a pretty prestigious college here, and you have to do oral presentations. She didn't want to do that because, and I can understand that. She graduated summa cum laude, and she did not want to walk because she was afraid people would look at her funny. This is after COVID was over, so no mask to hide behind it. So she did get treatment very rapidly. Within a month, there was, lucky for her, near complete elimination of her symptoms. And now, for the first time, she's actually moved out of her city to go to a graduate program about 200 miles from her home city. This is a major success for this lady. So she, Greg, comes immediately to mind because of two things. She could have been missed by me if I wasn't aware. Two, I could have made some major mistakes, which is stop medications that were actually necessary and effective. And three, if you do get the right diagnosis down, man, you can do so much good for people.
Thank you for sharing that powerful story. I mean, it brings to mind for me a couple things. One, if a person believes they may be experiencing TD, or a loved one of an individual believes that their loved one may be experiencing TD, you should say something. You should talk to your healthcare provider about it. Bring that to the healthcare provider's attention. And then secondly, it just reminds us that TD is treatable, that there is hope for a better life, and that there are FDA-approved medications as part of a comprehensive TD treatment plan. So just, I want to, before we conclude here, ask a couple questions if in the remaining time we have. What advice would you give to an individual who you believe may be impacted by TD, or their family member? And what beyond the medication that you mentioned, what does comprehensive TD treatment look like? Is there any insight you can share for us on that, Dr. Jain?
I'd be happy to. The first thing is stating exactly what you said, Greg. If you see something, say something. If you experience something, say something. Your healthcare provider is the right person to talk to. Don't hide. Don't hide. It doesn't work with tardive dyskinesia. Number two, feel empowered. Maybe 5, 6 years ago, we had nothing we could have done other than shake our heads in sorrow. But that's not the case. Today, we have effective treatments for tardive dyskinesia. And the third point, so glad you made that, Greg, which is the treatment of tardive dyskinesia is not just medications. It's more than that. First, you want to avoid developing tardive, and there are ways. If you don't need an antipsychotic medication, don't use it. Use the least effective dose for the shortest period of time. Those are very good rules to follow. But if tardive dyskinesia does come, educate yourself. because knowledge is power. Sometimes going to see a therapist is helpful. I've also found my patients who start practicing mindfulness meditation often report that the impact of tardive dyskinesia on them is reduced. Don't smoke. Smoking seems to worsen tardive dyskinesia. Try not to gain weight. Increased weight gain has been associated with more problems. So there are so many other things besides just taking medication one can do to live quite effectively, even if unfortunately tardive dyskinesia may have arrived in your life.
That's outstanding information. I think very, very powerful bottom line messages can be found in what Dr. Jan shared with us. So thank you, Dr. Jan, for your perspective and being such a, a beacon of light and hope for individuals and families who are affected by tardive dyskinesia. It's very meaningful and significant for us. So I appreciate you. Stacy, would there be any bottom line message that you would like to share sort of to wrap things up with any individuals or family members who may be watching this who believe that TD may be impacting their lives?
Yeah, I would just, echo everything that Rakesh just said. Knowledge is power. And so my hope is certainly as we all become more educated about TD and the ways that it can impact an individual's life, that we can reduce that burden by having more of those conversations.